Okay.
Where did it go? Sorry. Oh, there we go.
Okay. Welcome to the webinar today called, Canadian Culture and Communication is your program, but the webinar is called Nursing Ethics, and today we're going to talk about a portion of nursing ethics called professional boundaries. So I'd like to go through just a little bit of terminology related to the ethics. Look at some of the ethical principles and apply them to a couple of professional boundary cases. And these are just cases that we'll look at situations and what happened and what should happen and see what we can figure out. And we're going to think about, I want you to think about your professional boundaries and the differences between what we're talking about today and what you might have done in your previous practice in another country. And see if there's any similarities, if there's any differences, and then how you might incorporate what we've learned. So, do I need to work with this?
No.
Okay, so that's what we're going to look at. So what are ethics? That's a good question. People talk about you need to understand Canadian ethics. And so the definition I've got in front of you says the moral practices, beliefs, and standards of individuals and or groups. So basically, it's the basic foundation of how you practice or what you do. We have ethics for our lives. We have ethics for our practice. And we're going to talk about, this is nursing ethics today, not our personal ethics. They may overlap. They may be the same, but they may also be somewhat different. This came from, as you can see, a web page from the Canadian Nurses Association. And you can download the Code of Ethics for Canadian Nurses. If you Google Canadian Nurses Code of Ethics, you'll find it's a large document. You can download it. You can have it on your computer to look at if you'd like to. And I would suggest that you do a quick read of it someday before you write any nursing exams. It's a great thing to look at. So that definition, moral practices, beliefs, and standards of individuals and or groups. Code of Ethics, page 24. Okay. Some of the vocabulary that we'll look at is ethics, which we've already talked about. Then we're going to talk about professional practice, professional relationships, and professional boundaries. And what are they? Now, I think most of you know that professional practice is in nursing, the practice of nursing. It's how we carry out our profession, and what we do on a day-to-day basis is our professional practice. Professional relationships are those we work with. It could be your client, could be physicians, social workers, anyone else in the healthcare field we have professional relationships with. And then there's boundaries, and that's what we're going to be spending our time talking about. Where does my professional boundary start and stop? And when does it cross over into being a personal situation? And it's trying to keep the two separate, the professional and the personal, on different planes, so that we're not getting confused or confusing patients and getting ourselves confused and mixed up in situations that really aren't part of our profession. Now, I'm going to ask Briar for a second. Briar, could anyone speak to me if they'd like? Mm-hmm. Okay, if anyone wants to ask a question, I'd really like you to either type it or if you could, I think everyone, they're muted right now.
Oh, we can unmute.
Maybe we'll unmute your mics, because I'd like maybe to ask some questions. Let's see how that goes.
Thank you.
Okay, maybe we have to mute you because there's too much background noise depending on where you are coming from, and it makes it really hard to hear. So maybe if you aren't, if your mic is muted, which we have muted your mics, you can't speak to us. Why don't you type a note if you have a question, and I'll respond to it that way. I can see on the screen where you would type a note to me. So please ask a question if you think of something. Okay. Good. I don't see any questions coming forth yet. So we'll move on. Oops. Oh, not moving. Oh, because I'm not there. Okay, sorry. Okay, I talked about this already. The Code of Ethics for Registered Nurses. This is the website. Again, I suggest you go to it, download it, and then read it at your leisure. It's quite long, but it's used in all the different provinces as the Code of Ethics for nursing. So it's an important thing that you need to know that exists and that you may have to look at. So I'm going to ask you a question. This question says, how does the Code of Ethics for RNs in Canada compare to practices in other countries that you've worked in? Now, you may not have read the Code of Ethics yet, but have any of you had a Code of Ethics that you had to follow and had to know about in your practice, places that you've practiced? Has anyone not had a Code of Ethics? I'd like to know. Let's see. Okay, Debbie's got a great point. There's lots of references and need for the Code of Ethics in Module 3 lessons. Good to know. So I haven't heard from any students who are telling me about their Code of Ethics. Nobody's had a code. They know about a code, or they worked under a code, or they were aware of one. Okay, well, that's interesting. You might not see practicing nurses talk about the Code of Ethics very much, but it is something that is there, and it's referred to quite often in your textbooks and in Module 3, it's coming up, those kinds of things. Okay. Well, let's look at the next slide. Professional boundaries for therapeutic relationships. The things I'm going to tell you today are not really very shockingly new. And in fact, most of my information came from the College of Registered Nurses of Manitoba. And you'll see the website there. You can Google on the website, open the website and put in professional boundaries, and you'll find some documents that come up. And that's a lot of the information I have today came from there. Also, I looked at some of the other colleges of nurses in Canada, and I found that there's really a good document called Boundaries in the Nurse-Client Relationship from the College of Registered Nurses from British Columbia. It made the Code of Ethics a little simpler to understand. It made things in do this or don't do this. So it was applying it, and it made it much easier, I think, to understand. So I thought that was a good one to look at. So there's another suggestion if you're wondering about the Code of Ethics, or how to apply it, more specifically how to apply it. So what we're going to do is try and do an application here. I'm going to give you a case study, and I'm going to read it. I didn't make this up. It's actually, you can read it later from the CRNM webpage. Someone had written in and asked this question. So here it is. Case study 1, social media. A colleague of mine recently posted comments about her day at work on Facebook, which included her frustrations with our manager and some of the patients on our unit. Is posting information about our work, which includes colleagues, managers, and patients on our private Facebook account, a problem? Okay. I need some responses. What do you think about Facebook and writing about your day's work there? Shall I pick someone's name? Thanks to Debbie. Okay.
So yeah, we can unmute somebody.
Okay, maybe we'll unmute somebody and I'll ask. How about this guy? Yeah, or person. Is it Justly? Hi. Hello. Hello, can you hear me? Okay, don't know. No response there. How about Michelle? Okay. How about Michelle? Michelle. Would we hear anything back?
Oh, just unmuted herself.
Hello? Anyone got a response there? Maria, how about Maria? Let's go to Maria. She's up top. Who's unmuted here?
I can unmute everyone
Okay, unmute everyone. Hi there. Okay. Okay, you're muted again. All right. No one's responding, so I'm going to tell you.
Wait, do you want to try breakouts? And they
Well,
talk to
maybe. Sure. Go ahead.
Okay.
Sure. Try it.
Great. So just say we're going to.
Okay, Briar's got an idea about what's called a breakout. So she's going to put you together with some other of the students in the participating and discuss it together. So I'm not sure how it's really going to work. So Briar will take over.
Okay, so I'm about to do some breakout sessions, so then you can talk amongst your groups, because maybe you're shy to talk with the big group. So let's try it. If it doesn't work, we can always come back to the main room. So I'm going to create the sessions. So I'm going to create 3 sessions, and you're going to see on your screen, it's going to invite you to join a breakout session. So I'm going to create, and then you just have to click. Actually, no, create, and then create 2, yeah. Create all sessions. Perfect. Okay, so here we go. Let's try this. So click join. So see on my computer, I'm joining.
Oh, did Nina join? Looks like.
Nina and Debbie.
Ralph.
There's Ralph.
Okay. Michelle, okay, good.
Great. Hi, Ralph, are you there in my session? And just Dally hasn't joined. So you're with Maria. Can Maria and just Dally hear you?
Maria, can you hear me? Yes, no? Or just Deli? Can you hear me? No, I can't. Just Deli. Oh, that's Debbie.
Ralph, are you there with me? Maria and just Dally can't. Can you talk to them there?
Hello, can you hear me? Maria, just Deli? Hello?
Can't hear her. Why?
You can't hear me? No, I can't. No, is this?
Yeah, no, I can't. I'm just going to quickly join this.
Okay, sure. Sorry. Okay. Hello. Who's unmuted? Michelle, can you hear me? Michelle?
Yes, I can hear
Oh,
you
great.
now.
Okay, I can hear you too. What did you think about this case? Was there a professional boundary or an ethical issue related to this?
Yeah, I think the privacy of the patient.
Okay.
Yeah, because social media is open for everyone. Like, for example, if your friends or other colleagues know that you're working there, so even though you didn't mention any name or you didn't mention any name, they will still know who are you talking about. Yeah.
Right. Okay. You're right about that. And that's the situation here is that even though it's your private Facebook and you may have put locks or whatever on it, it's still there and it's still available because nothing's really private on social media is the problem. And sharing personal health information, even though names aren't used, people can make inferences and references and figure things out. And this was asked to a practice consultant at CRNM, and one of the I won't read the whole thing because it's quite long, but it said sharing personal health information, which is standard 4 of our standards of practice under communication and collaboration, which is an indicator number 19, but because it says nurses must communicate and consult with patients, the nursing team, and other members of the healthcare team for the delivery of safe, competent, and ethical care. So sharing private health information on your blog or personal account is not really keeping privacy at all. And also, the Code of Ethics clearly sets that the nurse has a duty to maintain privacy and confidentiality when stating that we collect information, we don't disclose it. So it's not what you need to do. So it's something that we need to be careful of. And also, when you look at this particular situation, it says that as a colleague of someone who did post private information, and you know that as another nurse, you actually have a responsibility to tell someone about that. So it's actually very considered quite dangerous. And it's one of the things that has come up in the last number of years because social media didn't used to exist. So they've had a lot of webinars and workshops on social media and what you can put and can't put on. So just be really careful with social media. It's one of those things that if you really aren't sure, don't do it. Don't say anything because you could cross a boundary and then it could become a problem for you in your professional practice. So you can complain about, I didn't like going to work, but you don't name names or mention things, or I think you should just probably keep your work life off of there, especially if it's frustration related.
What your colleague has done.
Mm-hmm. Well, okay, are you asking about what your colleague has done? Did you ask that? Okay, I think I missed somebody's question.
Betty Jane?
Yes.
I think somebody was just reading what I wrote and they were just reading it out loud.
Okay. Okay, right. Okay, yes, you're right, Debbie. We didn't have it scrolled up, so I didn't see that. And as a colleague, yes, it does say that if others are inappropriately accessing or disclosing personal information, it's part of something that you need to be aware of and sort of. Pardon me? Okay. So that's the first one about social media, and I think that's a biggie for our nurses today because when I was the first nurse, we didn't have any method of doing this. But now everything's out there in the public domain, so you have to be really careful. Boundaries are crossed if people can figure out who you're talking about or what you're talking about. And also, whose needs are being served? Whose needs, if you're expressing your frustration on your work, whose needs are being served, yours or the client's? Anyone have an answer to that? Michelle, did you hear that one? Oh, Michelle can't hear anything.
Hello.
The client's needs? If you're complaining, is the client being served or are you being served?
No, it's yourself. Myself.
That's right. And as a professional, our job is to serve the client, and so or the patient. So that's why whatever I feel is irrelevant to the to the situation. It's not, I'm just expressing my own frustration, which can be done, but not on a social media format. You can do it in your workplace, to your supervisor, to those you talk about and work with, but not on a social media where it's read by, who could be read by anybody. Yeah, thanks, Debbie. Right. Okay, any questions about that situation? Because we'll move on to a different one. Okay, let me just see here. Let's see what I wrote on. Oh, let me put this down here. Okay, I didn't push it. Okay, yeah. Okay, here's just a quick thing to read. Posting information about patients, colleagues, or employers may lead to them being identified. This violates the personal health information. And then these are the standards I talked about. And the Code of Ethics says it's responsible to intervene if others are disclosing and you know. Okay. Next one, another situation. This also came from Ask a Practice Consultant from CRNM. Now in this situation, you're the nurse manager in a long-term care facility. Mrs. Green has been a patient in our facility for some time. Although she is alert and active mentally, she is frail and dependent for most of her physical needs. She has one daughter who visits frequently. We became aware that Mrs. Green and her daughter had a falling out last week, and the daughter has not visited as usual this week. Mrs. Green told several of the nurses that her daughter will not be visiting anymore and that she doesn't know what she's going to do about her shopping and other errands that her daughter has been doing for her. One of our RNs, Dorothy, came to me and told me that Mrs. Green has asked her to pick up a few things for her when she does her shopping. Dorothy says she doesn't mind. After all, poor Mrs. Green has not the family to help her anymore, and she always gets along so well with Mrs. Green. Does this seem right? Question mark. Do I have a reason to be concerned? So that's a different situation. You're in a long-term care facility, and the patient is probably living somewhat independently, maybe like an assisted living, but there's a nurse there. So I'd like you to, I guess the breakout groups we won't do. We'll just, okay, Betty.
Yeah.
What do you think about this situation? About the nurse wanting to get groceries for the lady, her patient?
I'm not really sure, 100% sure, but I don't think it's right for the nurse to do that.
Okay, and why don't you think that?
Because I don't think it's part of the scope of practice. Like, it's not a usual thing for nurses to do that for their patients. Yeah.
Right, buying groceries really isn't something, it's not really a nursing function, is it?
Yeah.
Yeah, okay.
Yeah.
Okay, but it doesn't it seem kind of like that would be a kind thing to do?
Yeah, it is, but there might be other conflicts that maybe she might ask me or other nurses to buy something for her, and she might be very particular, and it might be a hassle for the nurses.
Okay, and you're right.
Job. Yeah.
Okay, good thing. Good response. It seems like it would be a kind thing to do, but you're right. As a professional, and we have to deal with a person on a professional level, and unfortunately, sometimes the personal and professional cross over, and it's difficult. I mean, it would be very nice to do something for someone, but you're right. If you're not working 24, you don't work every day of the week. So who's the next nurse that's going to do it? And it needs to be almost something more professional, established. Whereas she needs help, then we talk to her social worker, the caseworker, and they organize that her groceries get picked up. But it doesn't need to be the individual nurse that steps in to do it, because now we've made a situation that's going to probably it's not going to be very easy to figure out, and it's going to be a little bit messy. And what it says in the response that I got back, or no, I didn't get it back, but the response that came back for this situation said, the nurse-client relationship is a therapeutic one, and it's always an imbalance of power. And who's got the biggest power in a nurse-client relationship?
The nurse.
The nurse, right. So
Yeah.
it's not nurse client, it's nurse client, because we have extra knowledge and extra information about the patient, and they're kind of dependent upon us.
Mm-hmm.
So the imbalance results in the nurse's authority in the healthcare system and their unique knowledge and their access to privileged information, their ability to influence decisions by the client's caregivers, and the client is dependent on the service provided by us. So boundaries in that situation, it's not good to step over those. It's good to organize and call somebody who can make those plans, but not to do it as an individual. Because
Okay.
who would know? In order to buy groceries for the patient, I'll thank you, Betty, for your response. I might go to someone else, just see what they say. Okay, let's say hear him. Justale? Are you there? Can't hear me? Okay. How about, we talked to Michelle. Nina, can you hear?
Can I just step in for 1 second?
Yeah, sure, Debbie.
Justily is there and has told me she's experiencing some issues.
Some trouble. Yeah, I don't think she can hear us.
Yeah, she can hear you actually.
Okay, but I can't hear her. Okay.
So I don't know if there's something Briar can do on that end.
Yeah, I'm not sure what it is. Okay, thanks, Debbie. How about Nina? Can you hear?
Yeah.
What do you think about that, buying groceries for the lady?
Yeah, I think I should refer.
Yeah, okay. It's one of those things. It seems like a really nice idea, but it's not just you and her. It's every nurse and her, right?
Yeah.
And so to do it by yourself, you start taking on a personal situation as opposed to a professional one. So it's one of those. It seems like a great idea, and whose needs are being served? I think you're trying to serve the patient's needs, but it may not be the best method of serving the patient's needs.
Mm-hmm.
Because you can't be, like I said, you can't be there every day of the week to do all the grocery shopping.
Yeah.
Right. Okay. Good responses. Thanks for helping. Yeah, I'll just go to what I wrote on the next screen. So here's what came down. I've mentioned it before, but just a brief review. Nurse and the nurse-client relationship, there's always an imbalance in power, and usually the nurse has got the power, or usually does, because of all of the way we function. Decisions should be based on the client needs, and therefore making sure that if this lady has a need to get groceries, that we make sure that it's covered all the time, not just by one nurse. That wouldn't be the best situation. So whoever can make that decision, the nurse manager, the social worker, someone could sit down and make a family along with the client and family, if there is a need, to make a decision that would best meet their needs and not have one nurse have to deal with it. The Code of Ethics doesn't really speak to this situation like this exactly. It doesn't, you can't go there and find the answer to this question. You just have to think about it, and there's not everyone will even come up with the same answers, but it's a guide. So maybe you could go to someone else for guidance. If you aren't really clear on what this means, you should probably go to your nurse manager. That would be a good person to talk to. What should we do about this? I don't really know what the scenario is. I don't understand whether this is an ethical issue or a boundary issue. I'm not quite sure. Ask somebody, because you could read the Code of Ethics and the standards of practice, and you might never find your situation, and it's really confusing sometimes. So remember that you should consult somebody else sometimes about what to do. And usually someone in a power, like a nurse manager, someone above you that can make a decision with you. Okay, let's see if we can go to another one here. Where are we? Okay, here's one. Number 3, gifts. You are a registered nurse working in a Jerry rehab unit at a community hospital. You've been working the past 7 days and have developed a good relationship with a 93-year-old cognitively unimpaired but physically frail 93-year-old female, Mrs. S. It is the end of your shift, and today is your last day before 4 days off, so you go to inform your patient that you will not be back tomorrow. She calls you close to close the curtains and then offers you $50. She then says, "This is a secret between you and me. You've been so good to me." Okay, What about this scenario? Are there professional boundaries crossed? Are there any issues? What do you think? How about, do we get Ralph? How about Ralph? Ralph, can you hear? No, Ralph, are you there? Okay, we'll go on. Maria, did we talk? We spoke with you just a minute ago, didn't we? Are you there, Maria? Ralph, I can hear you, but my mic is giving some issues. Okay, thank you, Ralph.
Hello.
Maria. Hi, Maria.
Hi.
Did you read that last situation, the case
Yeah, I did.
about the gifts? What do you think about that?
I think like the nurse should not be receiving any monetary gifts
Okay.
from the client because it's against the like it crosses the professional boundaries of the nurse and the client.
Okay. Have you ever had this situation occur to you?
Yeah, but I did not accept it.
Okay. So I think it's actually something that can be quite common. People want to be thankful and grateful for their care, especially if you've been, good. And so they think of money, right? But it's one of those situations. It's funny because in our society, we give tips to certain sections of our society that serve us well. Like in a restaurant, we tip the waiters. You might tip your milkman. You might tip your hairdresser, but you don't tip your nurse. And a lot of times, the general public don't really think about it. They think, well, you did a good job here. Here's a little something special. And if we don't accept it, what might the patient think?
The patient might think that you're refusing the gifts that you're giving.
Right. And do you think they might be offended somewhat?
Yeah, somehow. But I've read that like you're allowed to accept something from them, but it should be for everybody.
Okay, very good. You're right. So that's the general rule for accepting gifts, is that, and you can say to your patient, thank you, but I cannot accept money from a patient. It crosses a professional boundary. You don't usually tip your doctor usually either, or your dentist. You just give the fee and you go, right? You're not giving extra money and say here, because sometimes it can be looked at as you're trying to buy some more service. And I'm not sure, maybe in some countries, I don't know, but maybe money helps to get better service. And that would be an issue that you might, if you've come from a country that happens in, it would be very different here to not use money. But we can't use money and we can't accept money. So make sure the patient understands that you're not offending them by saying, I can't accept that. So what we usually do as nurses, we get chocolates. We share them with all the unit. We get some flowers, or a gift of money can be given to a unit, to the entire unit, that they can then put towards some kind of books or professional development or something, but it can't be given to an individual. So you could redirect, or they could give it to the hospital foundation that's looking for extra money, but not to the individual nurse. And so that is the boundary. Good. Have any of you worked in a situation where patients did give you money and it was acceptable? Because that is a possibility. I'm waiting for someone to type something. Okay, I'm not seeing anything. Okay, I was going to read you while I'm thinking of it. Well, maybe we'll just go to the next question following this. I'll have to go here. Ooh. Okay, in this situation, again, the balance of power is with the nurse, and gifts can change the relationship. If someone gives you money, they may feel that they now have to have better service or more things, and that can't really be. We can't really treat patients differently based on money, because that's not how our system works. And I'm going to get the Registered Nurses of BC boundaries in nurse-client care just to read you something from that, because I really quite like it. If I can just flip through and find it here. because this is the one I think that it's a great document because it has things done in numbers up to 17, but one of them says, here's some things it talks about in relation to boundaries for nurse clients. Nurses are responsible for beginning, maintaining, and ending a relationship with a client in a way that ensures the client's needs are met first. So the client's needs are always number one. You have to always ask yourself, is it the client's needs or my needs? Nurses don't enter into friendship or romantic relationships with clients. Nurses don't enter into sexual relations with clients. Nurses are careful about socializing with their clients and former clients, especially when the client or former client is vulnerable or maybe need an ongoing care. You must maintain boundaries with the family and friends. And this is much easier to understand than just a bunch of principles that you have to apply. So I think this is a good one if you would look it up from the boundaries from the BC Nurses Association, you'd find it. But here's the one on gifts. Where is it? Number 17 says, generally nurses do not exchange gifts with clients. Where it has a therapeutic intent, a group of nurses may give or receive a token gift, I guess, to a client. Nurses may return or redirect a significant gift. So someone gives a gift and you say you can't accept it, then you can redirect it to your unit, to the hospital that you work for, but not you personally. Nurses do not accept a bequest from a patient. So these are very specific numbered things that we can and can't do. So that was just a little quick read of that, because I think if you read that, it would be quite explicit. I know some of you may be working in personal care settings or assisted living while you're waiting to be registered, and sometimes that comes up. We're working with the same people day after day. I know my mother-in-law was in assisted living, and she'd give her the person that came to help her a yogurt at the end of the shift. And I think taking a yogurt is okay, but not money. Okay, does anyone? Oh, here someone says, a token is a small gift to say thank you, flowers, chocolates, etc. Yeah. And a yogurt is really a little token gift to say thank you. Just some way to say thank you to somebody. Because sometimes she didn't give a yogurt to that person, to another person, because maybe they weren't as nice. So anyways. Okay, let's go on. I have another, what's the time? I guess I should look at the time frame. Wow, okay. We're going ahead along here. Where are we? Click. We have another one. That's a little, this is, I guess, the case 4. I recently cared for Tom, a gentleman with mental health issues on a unit in our smaller community hospital. Tom has been unable to work for some time due to his health concerns, but is planning on returning to work after discharge. I was aware that he operates a yard and lawn care service. I asked him if he could mow my lawn throughout the summer and then asked what his rates were. Tom said, pay me whatever, and seemed glad to have the business. I offered to pay him $20 for each time he came. I thought this was reasonable and felt good about providing work for him. When I mentioned this to my coworker, she said this was a boundary violation. Have I violated a professional boundary by trying to help out someone from my community? What do you think about that? Anyone have a response? Okay. Or how about the last one there?
Oh, Teresa.
Yeah, Teresa. Teresa, can you hear?
Yes, I'm here.
What do you think about this one about having the man who was a patient mow your lawn for money, for a paid job?
In this case scenario, I think we should not ask. We should keep the boundary. In nurse-patient has it's not a kind of therapeutic nurse-patient relationship.
Right. Now,
in this case scenario, she should not ask the patient to do her lawn. If she really wants to mow her lawn, she can ask the help from outside. Like there are so many other agencies, but should not ask the patient to do.
Okay.
It's not a good to ask the patient and take advantage of that kind of. because she should have a maintain a therapeutic nurse-patient relationship.
Right. And the patient has just recently been her patient. It's not like the patient was a long time ago and is no longer requiring care. He's just been discharged, it looks like. So it's very close to the time where she was caring for this patient. So that I think time has an important it's important to look at time, especially if you're I also can see that this can be a problem or more of an issue if you work in a small community. And in Manitoba here, some nurses work in very small communities. So regardless of whether you're the nurse or not, you know all of the people that live in your community. So it's a little bit more difficult to have those boundaries. Keep them, because this might be the only lawn service that's available. Like, there's things to think about, and I think where you live and where you work are considerations to think about too. If you're working in a big city, it wouldn't really matter. There's going to be one person versus another. But yeah, I agree with you. That's a good job, and that's like one of the situations we just read about. This patient's recently been yours. Now, someone else here have something they'd like to say? Who do we have here? Oh, Tiana? No, Mike. Okay. Maria doesn't have a mic on. Michelle. Mm-hmm. Michelle.
Hi.
Hi. What about this lawn mowing situation?
Yeah, I think we should not ask Tom to work for her.
Okay.
Yeah, because there's still a nurse-patient relationship, and another thing is Tom is with a mental health issue. So even though he is just discharged already, in case like he has he has recovered, but then after a while, if he gets admitted again, then that will be a problem.
Then you're a patient again. And I noticed if you look at this scenario, it says that I as the nurse, I asked him if he could mow my lawn. It's not like the patient said, could I mow your lawn? I need work. It's like the nurse has requested it from the patient. And I think that's one reason it makes this a professional boundary, because the nurse is requesting it. If the patient had asked, you could sort of say no. Now, what's the patient supposed to say when the nurse asks, can you mow my lawn? And he's doing a lawn care service. He feels, because there's an unequal balance in power and the nurse is more powerful, he feels he needs to say yes, right? He probably doesn't feel he has a choice, or may not have a choice. So that makes it an unequal situation, that the nurse asked him about doing the job. It's sort of like when your boss asks you to do a job, you don't usually say, no, I'm not doing that. You usually do it, right? Because they are your superior in that situation. So I think that's one of the situations here that makes this not a good one, or a good one in the sense that a professional boundary has been crossed. The nurse asks the patient. We don't ask patients to do services for us. It just makes them feel they probably are obligated and they need to do it, whether they really want to or not. And again, what should I pay you? Oh, whatever you want. The patient doesn't even want to tell. Maybe doesn't know, but maybe again he feels like I better not ask for too much. I don't know. It's an odd situation. So you're right. I think it should be best left therapeutically. He's the patient. He goes and is discharged and does what he does, and you're the nurse, and you don't cross paths if you don't have to. Okay, thank you for that, Michelle. Okay, is there anyone who'd like to comment on any of these situations? Or I asked again about your experience working in another area or jurisdiction other than Canada. What has your experience been the same? Or has there been a different experience? And I know from my years of being a nurse that things have changed. When I was first a nurse, these issues were not so it wasn't really discussed. I mean, whether certain boundaries were, it was like a smaller group of people in a smaller time and a smaller setting, and it wasn't really, the code of ethics wasn't such a big deal, and it has developed, and I think we need to, it keeps changing and things keep changing. Social media has come along and we have to keep remembering we didn't used to have privacy of health information. It wasn't a legislated thing, and now it is. So things have really changed in my years. So it'll probably keep changing, but this wasn't something I discussed as a nursing student, that's for sure. So it might be new to you. It may not also be new to you. Okay, how do the Code of Ethics for RNs in Canada compare to practices? I asked before, but no one came up with any situations. Did any of you have a Code of Ethics that you functioned under as a nurse? Does anyone want to type anything? Okay, Michelle, I'll ask. Michelle, did you have a Code of Ethics?
Yes,
You
we
did?
do have.
Okay.
Yeah.
Okay.
I practice nursing in Philippines and Singapore, and it's like, yeah, like the example we discussed, the receiving of gifts. We are not allowed to receive monetary gift from patient, but we're allowed to receive as a group.
Okay.
Yeah, if they give it. Yeah.
So it's much the same. And I see Ralph has read a note. The Code of Ethics are pretty much the same. So maybe it's becoming, the Code of Ethics for nursing might be a little bit more global than I even know.
Mm-hmm.
Maybe it depends where you work. Okay, let's see if we go to the next one. Thank you, Michelle. Nina?
Yeah.
How did you work with the Code of Ethics?
I think it's just the same. I also work in the Philippines. You also practice the same thing.
Same thing. Okay. So maybe, and okay, I wonder if anyone practiced outside the Philippines. Let's see. So that's Philippines and Singapore. Okay, Ralph. Oh, Ralph couldn't talk to us, I don't think. Ralph wrote that much the same. Did you practice in the Philippines? In the Philippines, Ralph, thank you. Maria? Hello? Maria, did you practice with the Code of Ethics? Hello? Maybe she's not. Are you hearing me, Maria?
Oh yeah, sorry.
Did you practice with the Code of Ethics?
Yeah.
And
but in the Philippines too.
In the Philippines too. Okay, we're getting the same country. Okay, thank you. And Teresa, are you there? No.
Same. The code of ethics in India are the same, but
yes.
I worked in India as well as in Ireland.
In Ireland, okay.
Yeah. So the code of ethics is the same. So we don't accept. I worked in a psych unit in Ireland.
Okay. In Ireland, yeah.
In a psych hospital, and it's a very small hospital. Like very small mental health hospital.
Okay.
Hospital, and there is a lot of people, like sometimes there is a unit. They have a unit called like Alzheimer's, it's of elderly.
Yeah.
When we work with them, like the relatives do bring like together in the in the occasion of Christmas time. They give a lot of chocolate boxes and wine for the nurses who care for the elderly, but collectively, not like we are not allowed to accept.
And that's similar here too. Collectively at Christmas time, there's usually lots of food, candies and food and drink and stuff that is given collectively. You're right.
Yeah.
So it's so your experience is similar to this code of ethics and the standards of practice.
In India, sometimes, like in the village hospital or community hospital, some people give like money, other like sweets personally, but some nurses will, or sometimes they do. So it's kind of, in private hospitals, we do have private hospitals and public hospitals.
Okay, and that's very different.
Not allowed, but some nurses may take, sometimes.
Okay.
If they are very close and if they are very, they form the relationship as well.
Well, I know if you work in a small community in Manitoba, you may have a very different relationship than if you worked in Winnipeg, because there's some very small communities where you would know everyone and everyone would know you, and it would be a different scenario. And trying to keep that therapeutic line drawn is difficult when you're in small, when your neighbor is your patient and you are the friend of, on it goes. It's much more difficult to keep those boundaries in a bigger center where you don't see people anymore. It's very easy to do, but not in small communities. So that can be a bit challenging. But thank you for your response there. So we've had the Philippines, India, Ireland, and Singapore, and everyone's got sort of similar experience. Well, that's good. So this really isn't very new to you. I guess that's good and not good, because if it was new, you might be learning something, but maybe it's just reviewing what you already know. So, okay. So the next steps, what would you do after we've run through the material that I've got here tonight? If you have a question that's related to nursing, you can do Ask a Nurse through the CCN website, as you can see in front of you. And this feedback survey is for this workshop. Okay, this is a feedback survey for this workshop, which would be great if you did. And it'll go, I guess, to Briar Manola, and they will just see how it turned out. We've never done it on a webinar format before, so it's new, and it can be changed. And if you've got ideas for topics, you can also send them in too. So, is there any feedback from anyone? I'd love to hear it or read it. And other than that, we're just about at 8 o'clock, and we had kind of a crazy start today for this. We had to move venues, and Briar had to organize this, so I thank her for doing that, because we thought at one point we might have to cancel everything. So I don't see anyone sending me any messages.
So I'll unmute everyone.
Okay,
So
she's going to unmute you. Okay, so you're welcome, Debbie. Thank you for being here.
Thank you.
You're welcome. Thank you.
You guys both did incredible. Trey, you and the blind auditions, I watched again just the other day, and you came out swinging in your blind audition, and when I hit my button.
Okay. Okay, adios, bye-bye. Done.